Salam alaikum. Dear colleagues, I'm very pleased being with you today. It's an honor and also a good luck to be able to be here in this fantastic country, not only because of the architecture and all the things you have achieved, but also because we met a lot of very smart, highly educated, but also open-minded and very cheerful people here. And we are very happy and very glad to be here with you today. It's an honor for us. I would like also to thank the organizing and scientific committee for their kind invitation. Of course, Professor Steve, but all the people who have been in this organization, and we are very happy sharing with you what we have developed in Montreal. And as it was said before, this is an ecosystem or a community of innovation that we will introduce during this presentation that was able to achieve these results because we cannot do that alone. It's a partnership between different stakeholders, academic, hospital people, but also private companies. And during this trip, we came here with a delegation of about 15 private companies to explain how we developed with them and how we were successful to implement this innovation, especially based on artificial intelligence. First of all, I would like to say that it's a teamwork and not, even if it's me that you choose for the presentation, it's on behalf of all the people who were involved in this hospital of the future. I would like to thank a person who has been with me during this last 13 years implementing innovation and artificial intelligence. And without her, I wouldn't be able today to make this presentation. Her name is Cathy Malas. She is the Vice President of Innovation and Artificial Intelligence in our organization. And she came here and she is present in the room. Cathy. Thank you. I will briefly present some of the achievement we had because some others will be presented by some of our researchers of our hospital or our university. So I will focus on the other part of the presentation, which are more in other specialties at mental health. I would say too that without the University of Montreal, we wouldn't be able to have developed all of these things, as our Dean of the Faculty of Medicine, who is a very well-recognized neuroscientist and researcher in this field, and also the Faculty of Art and Science and the Department of Mathematics and Artificial Intelligence, with now more than 1,000 researchers. We have here Alexandre Boutier, who is one of them, and who came with us here. And if you have any question, I'm sure he will be very happy to respond to all of you. So I call that the hospital of the future. What I will present first is what we are now, today, but what we imagined 5 years ago, a little bit like Professor Steve, we imagined the future at this time, and today we have realized what we had in mind 5 years ago. But I will finish by what we will do in the next years as a perspective after the end. I am the president and CEO of the University of Montreal Health Center, but also the Health Network. The Health Center is about 500,000 patients a year, 772 beds. The network is 17 institution and 4 million inhabitants that are covered by this network. All of them all the things I will present are always data-based, artificial intelligence powered, and value-oriented, and we measure the value of everything we implement. Sometimes there is no value, and we withdraw this innovation. Yesterday, we met with the senior management of one of your hospitals, and the first question they ask us is, but you are implementing artificial intelligence in many sectors, but is it really something good for quality of care or for performance of the organization? And we answered, if it didn't work, in that case, we withdraw this innovation. So, the University of Montreal Health Center is a hospital that has been delivered 5 years ago. It's merging of 3 hospitals, and it's a campus downtown Montreal of 4 million square feet with a research center, an academic for education and training, 772 hospital beds, a huge ambulatory care department, and also a coordination center for coordinating the network that I mentioned before, that will help the patient to be oriented toward the right place and also to measure the impact of what we are doing in hospital before and after hospitalization. I would like to say that we had a vision 5 years ago, and the president of the board of the CHUM is here. And this is something that not only is supported, but also he was step by step a major player and a leader in the implementation of this strategy. This is Dr. Régent Baudet, who is also here present, and as a cardiac surgeon who was extremely innovative during his career and with us now. So we had the mission of delivering tertiary quaternary care, but also to accompany the patient during the pathway. And we have the vision to be a world leader in artificial intelligence. And this is why I said before, we needed to develop a community to get this vision and to become a reality. We are, as I said before, value-oriented. That means that everything we implement in terms of, on the right, with the Institute for Healthcare Improvement, the optimization of the performance of the hospital, or at the left, the introduction and implementation of genomics and artificial intelligence, we always measured the result on this quintuple aim, which is patient experience, population health, health cost reduction and resources optimization, team and staff experience, and also knowledge that we developed during all this year. Yesterday, we shared with other colleagues from here, and we say, do you have any challenges? Because if you implement something new, it's because you have challenges. And they said, yeah, we have challenges. And they said, that's good because we also have challenges. And probably today, the most important is human resources and, of course, financial, because the cost of medicine is increasing all the time. But human resources is probably one of the most important problems that we have everywhere in the world. And how the things we implemented aimed at solve these 2 problems. How we can improve the human resources flourishing, attracting talents, and developing with them what we wanted to do in terms of implementation of artificial intelligence and innovation. So this has been conceived as a learning network in which we use the human intelligence, individual and collective, the artificial intelligence to reach what we call now enhanced intelligence by a combination of human and artificial. We are not in the future with Neuralink, with the patch of artificial intelligence inside the brain, not now, maybe in the perspective, but it's just a combination of both AI and human intelligence inside a community of innovation. What exactly we mean as a community? When we want to develop something new, we need all the stakeholders to be involved in this innovation from the beginning. The first, as we saw here, are the students, are the researchers, are the patients, are the family of the patients, are the citizen. And all of them, they are involved in what we are doing. But also all the healthcare providers, the managers, the teachers, the researchers. And this is what we call a community and what we have developed here as a community ship. Of course, you need a leadership too, because if you have someone who wants to develop and to innovate in an organization which is very conservative and doesn't want to innovate, it's very difficult. And this is why I also want to recognize here the high contribution of one person who then became the leader of innovation in Quebec, Luc Sirois, who is here with us. And at the beginning, when we met 12 years ago, we created the first Hacking Health event, which was called Hackathon, and in which we had patients, students, family. We also have healthcare giver, researcher, a community of 600 people, the first and the largest in healthcare, Hackathon, and we developed about 60 new products. Only 5 or 10 were at the end used, but it was a very good experience of how a community of innovation can be built up. Thank you very much, Luc, because it was fantastic. Oh, I have been a little bit too fast. So the most important thing after is to identify talents. We have talents everywhere in our organization. And sometimes this is not what we expect to be a talent or the most talented people. Sometimes we identified some of them. We have meetings, for instance, in which we had very talented people and nobody knew that. So one of the things we are doing is always to try to search and identify the new talents. Then we have training. Training is very important. Education is very important. Yesterday, I was at the panel with the Vice Dean, and we discussed about the role of the Faculty of Medicine or the Faculty of Nurses, and it was very important to understand the role of training. But education has changed. Now we are training the patient, the family, the healthcare givers using artificial intelligence to teach them, to increase their level of knowledge in digital and artificial intelligence. So it's not anymore a teacher, a human one. This is again, we enhanced education using artificial intelligence. We have created in 2018 the first school for applying artificial intelligence in health. It was after a meeting with our international network for innovation. Now we have more than 4,500 students. And as you can see, we are increasing all the time the number of students and the number of episodes to learn, teach, share what is in artificial intelligence. We also have developed the first data lake. A data lake is a place where you can pour all the data from different sources and then use artificial intelligence, deep learning algorithm to make the correlation and to better understand the pathology, the physiopathology, or the clinical symptoms, or also to do research in the real world. We are now developing, and maybe it's something that we can share, the way to develop this data lake in different hospitals to create a huge data lake and maybe an international one in which we can apply artificial intelligence tool to better understand how we can improve the care or even prevent disease. Sorry. So what we say too is we always measure the result in terms of value of all the application of artificial intelligence. Here is 95 application in all the sectors, including logistics, including research, education, everywhere as a corporate strategy. But for all of them, we measure the value on the right part of this slide. We also are combining the research in life sciences to the development of artificial intelligence to rapidly increase the knowledge both on the genetic or genomic factors, the new medicine, the new cell therapy, or the new way to treat, with the progress that we make with artificial intelligence-led product. That is an overview of our community of innovation that we have in Montreal. I could have shown the same with 100 academic hospitals throughout the world, in which we are combining and sharing all the innovation together. We were supposed to have the Forum on Health here in Dubai last November for this meeting, but unfortunately it was canceled or delayed and reported to another time. Couple of examples, and all the companies that have contributed to develop these tools with us. Some of them are present in person and you can meet with them. Some others are virtually present because we couldn't make all of them come here because we decided to come in person just 3 weeks ago. So we rapidly organized this delegation, but it was not possible for all of them to come here. But see here, we have Ivado Labs, who is here, Scale AI, which is in Montreal, 2 of our ministry, Polytechnique, which is a school of engineering. We have Gray, which is in Montreal. They didn't come, but other you can see them here. Other examples of what we have done: Telehealth 4.0 with Diagnose that help us with a picture of the eye to make the diagnosis of retinopathy and to follow the patient with diabetes, trying to avoid them to get it. And if they have signs of retinopathy, they are treated very early. And we can replicate that very easily with pictures that we send by telemedicine and then use AI-powered tool to make the diagnosis. On the right side, we have Leomed. This is to improve the efficiency and the flow management of the patient in the organization. Logistics and supplies, we have 2, they are here. Muta is on the right for decision support for patient-demanded supply chain, and Logibec is working to improve the predictive analysis solution in the OR. So just examples of what we are doing. One thing which is also important for the academic and non-academic hospitals is the fact that it's not always easy to use evidence-based medicine because it's not always available at the bedside. We have now tools with artificial intelligence to rapidly get the information and push them immediately at the bedside when the clinician needs to get access to the literature. We also have all this telemedicine inside the hospital, outside the hospital tool with Internet of Things, connected object, and all the data are then poured into the data lake to help us to better understand what we call the exposomic, which is all the environmental factors that we are following. An example, I don't want to go too far in this field because it will be probably presented by some of our researchers. This is for severe seizure in which we have the in-hospital research lab, in which we will follow by artificial intelligence the continuing electroencephalogram record. We have at home all the connected objects, and we have the neuro pacemaker to have the treatment when the facial recognition of the patient face will see that there are some signs of new seizures that is coming. So it's a complete loop inside the hospital, outside the hospital, and with the treatment by the pacemaker here. The perspective where we are going now is much more to go beyond or before the disease and to go to health promotion, population health, and now with AI, personalized health. Again, what Professor Steve said before, when we were before the capacity of artificial intelligence to analyze data, we couldn't follow the patient before the disease or after the disease because there are too many data, and the human brains, even with a huge team, are not able to treat all of the data, to process all of this data. So now with AI, we are able to go beyond the disease, predict, prevent, or make the patient come back to the healthy status, physical, mental, and social health. And this is something that we are developing, is what we call now the Health Innovation District. You know, in the world, this is something that is developing everywhere. And we hope to do that with Dubai, Abu Dhabi, and the Emirates, in which we will work on the environment to reduce the risk of developing disease or to make the patient, after the treatment, become healthier again. This is in downtown Montreal. We are building our first building to receive all the researchers, both public and private, all the companies, all the institutions from all over the world. And we will study in rural, semi-rural, but also in urban and semi-urban environment to see what will be the impact, beneficial or deleterious, on the health of the population, on decisions we make, for instance, in global warming prevention, or in the transportation system, all the impact that we can measure, again, because now we have the researchers in the field that will benefit from the data analysis and the decision-making prompted and helped by AI. This is an example of what we have developed in terms of vision, the current one and the future, for diabetes. Diabetes, as we know all, is a disease which impacts a lot of citizen patients, and it's a risk of complication which is important, but also it's a cost, a burden for the system. So we develop with, again, see different partners here, polygenetic scoring by Optiterra to see who are the patients at risk of complication or the citizen at risk of diabetes. And then we use connected objects to follow the patient or the healthy citizen in their life to be without complication or to decrease the risk of complication or to prevent the risk of disease. And this is a combination, as we conceive now, the learning health system, which is a combination of knowledge in life sciences research, knowledge in artificial intelligence-driven data analysis and decision-making, and the proof on the health of the population that all the treatment or the change we make will increase and improve health or treat better the diseases. What is the next step? And here I want just to slow down a little bit on what I said before: physical, mental, social health, how academic hospitals, academic network, academic learning health system will interact in the future with the life of the citizen on an individual and group basis, following them maybe in the desert, as you said before, but also in different environments in which the person will go, including the metaverse, because we will see what will be the expression of their physical and mental health in another environment. When you are selecting your avatar, sometimes you express some of your mental health or disorders. And what we are working on now is how the SHUM metaverse will be developed in the near future. And this is what I just want to introduce. That is our vision today. What we have shown until now, what the result of the vision we had 5 years ago. By the way, we have been selected as #1 smart hospital after the vision we implemented last year by Newsweek. I hope we will develop this future together. This is our offer to develop in our international knowledge and innovation network, having you as partners.